you today?
I'm good. How are you?
I'm good. I'm Ashley. I'm going to be your student nurse today, and if you don't mind, I'm going to go ahead and do a head-to-toe assessment on you today.
Okay.
What's your name?
Jennifer Stewart, England.
Nice. And what do you prefer to be called?
Jennifer.
Perfect. Alrighty. First, I'm just going to get a little bit of information from you. Do you have any personal history as far as illness? Take any medications?
I take medicine for sleep. I have insomnia.
Okay. And how long have you been taking that?
About 8 years.
Awesome. And it does seem to help with the insomnia?
It does. I take Ambien CR 12.5.
Perfect. And do you have any type of family history that?
My grandmother had breast cancer, and my grandparents have high blood pressure and diabetes.
Alrighty. And you've never had an issue with either one of those, right?
No.
Good deal. Alrighty. And as far as your general appearance, your skin looks good, even toned. You're dressed appropriately for your age. You look well nourished. As far as all that goes, everything looks normal.
Okay.
So, alrighty. Now, if you don't mind, I'm going to go ahead and assess your scalp and see if there's any lesions or anything that I need to be worried about there. No tenderness so far noted, right?
No.
Everything feels good. Good deal. Let me make sure there's nothing in the hairline that I need to be worried about. Any dry flaking. Alrighty. It looks good. There's no debris. Your hair's nice and shiny, smooth, and evenly distributed. Now I'm going to go ahead and test some of your cranial nerves. So if you don't care, can you pull your mask down just for a second?
Mm-hmm.
Awesome. Okay, I'm going to have you close your eyes really tightly and then open them back up. Then smile. Frown.
Sorry.
Well, that means you're naturally happy, right?
Yes.
And just puff your cheeks. Awesome. And now just go ahead and close your eyes, and I'm going to take this little cotton ball and you just tell me if you feel that.
Yes. Yes. Yes.
Awesome. So far you're nice and normal. Alrighty. Okay, and I'm going to go ahead and check your temporal arteries. Everything feels good there. No tenderness, right?
No.
Awesome. You're bilateral on both sides upon my palpitation. And now let's go ahead and do your sinuses. It doesn't hurt, right?
No.
I don't feel any type of swelling, so that's a good sign too. Nothing there either?
No.
Perfect. Now I'm going to go ahead and check like your temporomandibular joint. Okay, go ahead and try to open your mouth for me. Awesome. No crepitus, no cracking and popping there like a Rice Krispie treat.
No, but those sound good.
Now I'm going to go ahead and do all your lymph nodes. Awesome. Good deal. And there was no tenderness also. Awesome. And let me go ahead and get your carotids. Perfect. 2+ on both sides, so that's nice and normal. And now I'm going to go ahead and check the range of motion of your neck.
Okay.
So if you could just go ahead and put your ear to your shoulder on both sides, lick both ways, and then lick up and down. Awesome. That looked good. And let me check your trachea, see if all that's nice and midline for you. That is good. And one last cranial nerve, I'm going to check and see if you can shrug your shoulders against resistance right now. Awesome. Alrighty. And now I'm going to go ahead and examine your eyes. I'm just going to inspect to make sure there's no deformity, any redness. Your lashes are curled upward. Your eyebrows are full and even. They're both symmetrical. No redness or anything like that's noted.
Okay.
Now I'm going to look at your conjunctiva. Alrighty, that looks good. It's pink and moist. Your sclera is white. Now I am going to, okay, tell me whenever, just look straight at my nose and just tell me whenever you see these.
Now.
Okay.
Now.
Alrighty. I'm gonna go ahead and check your pupils. If you just look kind of past me, I want to see how they react. Alrighty, go ahead and look past this way. Alrighty, they reacted to light. Okay, just keep your head straight and just follow this with your eyes. Don't move your head.
Okay.
I feel a little bit cockeyed there.
That's okay.
Good. Alrighty. Followed everything correctly. Okay, I'm going to have you cover one of your eyes and read the line that you can see the best.
DEFPOTEC.
Okay, now go ahead and do it with the other one. Let your eye focus back.
FELOPZD.
Awesome. Alrighty, now it's time to inspect your ears. Just make sure they're both nice and symmetrical and there's nothing that we need to really worry about as far as redness or tenderness. That felt good, right? Nothing? Okay, good deal. And now, let me go ahead and look inside there just to see if there's anything going on that we need to worry about. Oh, they look good.
No wax.
Nice and clear. That looks normal, no redness or no irritation. Alright, now I'm going to say a word and I'm going to whisper a word and I just want you to repeat the word back to me.
Okay. Apple.
Perfect.
Banana.
Awesome. Okay, if you want to go ahead and just pull your mask down for me just a little bit, I'm going to inspect your nose. No tenderness or anything like that, right? Perfect. Everything looks good, symmetrical, no deformities. I'm going to go ahead and look up in there just for a second just to make sure there's nothing you need to worry about. Nope, everything looks good. No deviated septum or anything like that, so that's a good thing also. Okay, and if you want to go ahead, I'm going to do a smell test on you, so just close your eyes and just tell me what you smell.
Alcohol.
Oh yes, 70% of it. Alright. Now I'm just going to go ahead, just keep your mask off. I'm going to go ahead and look in your mouth.
Okay.
Alrighty. Your lips and that they look good. They're nice and moist. They don't look like they're dry or flaky. If you want to go ahead and open up for me. I don't notice any kind of like thrush or anything of the sort. Just lift your tongue up for me. Perfect. And just stick your tongue out and say ah. Ah. Your uvula is working properly. Tonsils look good. And you stuck your tongue out so your cranial nerves are working also. Let me go ahead and get you to swallow, make sure. Awesome. That is perfect. So far, so good. Okay, now I'm going to go ahead and inspect your chest. Let me just go ahead and take some rest for me just so I can make sure that it's expanding properly. Yep, it looks good. I'm going to go ahead and listen to the front here just to make sure your lungs sound normal. Okay, take a deep breath for me. Okay. Nice. Okay, get that side. Okay. Perfect. One more time on this side. Good. I didn't hear any kind of crackling or wheezing or anything like that, so that's a great thing. And your chest expansion was symmetrical. Let me go ahead and have you lean forward some just so I can test your curvature of your spine and any kind of tenderness.
No tenderness.
Perfect. All that's midline. I didn't notice any type of scoliosis or anything like that, just by palpation. Okay, and now I'm going to go ahead and do the back. If you need a break with the breathing, just let me know. I don't want you to pass out on me. Okay. Okay. Perfect. Okay, one last time. Great, all that is still sounding really good. Alrighty. Now let me just go ahead and look at your nails and make sure everything looks good there. Yep, nice and normal. Capillary feels good. It goes back in less than 2 seconds. And there's no clubbing or anything like that. Let me check your skin turgor. Yep, nice and elastic, goes back in less than 2 seconds. Alrighty, let me go ahead and check for your apical pulse here. Okay. Perfect. Now I'm just going to listen to all your heart sounds. Perfect. Last one. Awesome. Alrighty. And let's just go ahead and get your pulses as well. Okay. Get your radio. Normal. Brachial's a little tricky person. It's just different on everybody, isn't it? Okay. Go ahead and get your femoral if you want to just lay back. Okay, just gonna. Perfect. Go ahead and raise up there for just a second, and I'll get the other. We'll go down to the lower extremities now, and I'll check the pulse in your legs. Alrighty. Nice. Alrighty. Nice and strong pulses. Alrighty. And now I'm going to go ahead and teach you how to, sorry, no, you're fine, do a self-breast examination. Have you ever done one on yourself before?
Occasionally, but not often.
Nice. So you know there's 2 methods that you can use. Whenever you start, you just put your hand like behind your head like this. And whenever you start, this is the circular method. Just start close to the areolar and just move in circular motions all the way around. And make sure you keep going out as you go in circles.
Okay.
Because there's breast tissue that comes all the way over, like close to your aorta, and there's also some like next to your armpit that you want to make sure that you palpate as well.
Okay.
There's also a method called the vertical method, and that one you just go up and down.
Okay.
So it's pretty simple most of the time. And it can aid in early detection, so that's even better.
Yes.
I'm going to go ahead and have you lay down on the table for me. I'm going to go ahead and do all the fun stuff on your stomach here. So go ahead and raise your shirt up for me. I'm just going to pull it down just a second.
Okay.
Just so I can make sure. Everything looks good as far as symmetry goes. I don't notice any type of deformity. I don't notice any type of like ascites or anything like that, so that's good. No fluid buildup on the stomach. Okay, I'm just going to go ahead and listen in on all the quadrants here. Perfect. Alrighty, that sounds good, nice and normal. I'm just going to percuss the quadrants. Alrighty, all that sounds good. And I'm just going to lightly palpate first, starting out. So if that bothers you or you feel any type of tenderness, you let me know. Perfect. I didn't notice anything serious there. Awesome. Okay, you can go ahead and put your shirt down now. All that is nice and normal. Your bowel sounds were normal as well. Okay, and I'm just going to go ahead while you're laying down. I'm just going to go ahead and inspect your lower extremities.
Okay.
All the hair is evenly distributed. There's no signs of deformities there also. I'm going to check for edema. And that looks good. There's no type of swelling or anything like that, so that's definitely a good thing. Definitely don't want that. Alrighty, now I'm going to test your brain. Can you tell me like a recent memory, like what did you have for breakfast this morning?
A biscuit.
Nice. Alrighty, and I'm going to go ahead and I'm going to tell you 4 words completely unrelated to each other. And I just want you to repeat them back to me.
Okay.
Okay, spoon, clock, bear, and socks.
Okay. Spoon, clock, bear, and socks.
Awesome. And a memory from a year ago, is there anything specific that sticks out in your mind?
Vacation.
Oh, yes. Nice vacation. Alrighty, and I'm going to go ahead and check your range of motion of your spine now. So if you want to go ahead and stand up and just kind of bend over and touch your toes. Awesome, and the spinal curvature still looks normal, so that's a good thing also.
Okay.
And you go ahead and see with your arms, just go ahead and raise them up and then raise them or point them out this way and then back in and then back down. That works. And then your legs, just go ahead and like raise them up one by one just to see if they're
okay.
And there was no difficulty in moving any extremities, right?
No.
Perfect, even better. Alrighty. Okay, now I'm going to go ahead and have you do this. Tandem walking, just put your heel to toe and just walk a straight line.
Okay.
Let me check your balance there. I'm not very good at that myself, so.
Okay, alright, we got it.
And now the Romberg test, I'm going to have you just stand still,
Okay.
close your eyes, and I'm going to check to see how your balance is whenever you are saying it looks good to me. So you didn't even sway. Okay, go ahead and have a seat, and I'm going to go ahead and test like the dull and the sharp. So just go ahead and close your eyes, and you feel that?
Mm-hmm.
Good deal. Then there's the
Mm-hmm.
nice and sharp. Awesome. Alrighty. And now, if you want to take your fingers, just do finger to finger for me. Awesome. And then take your finger and go finger to nose. Great. And take your heel and rub it down your shins. Awesome. And now I'm going to check all your reflexes.
Okay.
So, relax for me. legs first. Your pesky little reflexes. There we go. You're awesome. Okay, just go ahead and that for me. And just go ahead and relax it. Perfect. Oh, I'm sorry.
Yeah, you're done.
Just flex your arm for me so I can get right in there. Okay, now relax it. Nice. And then, last but not least on this side. Should probably be behind you in case I get nice little hit there, but and flex one more time. Nice. Oh, sorry, no, it's okay. I'm not sure if that's your arm moving or my stethoscope. Alrighty, and the last thing here, I'm gonna go ahead and check your hand grip. So if you just take, oh yeah, nice and strong, sister. Alrighty, we are all done. So thank you for being my patient, my very first patient. Yay! Awesome.